Hello everyone, welcome to Yellow Pages Nursing. Today's topic is an interesting topic, Nursing Officer Exam Preparation. This video comprises of some of the important multiple choice questions among top 20 topics. We will be discussing 100 questions divided in sessions. To keep in touch with the continuation, subscribe our Yellow Pages Nursing channel by clicking the bell icon so that you get the instant notification as it gets uploaded. Nursing Officer exam comprises of 100 questions for a duration of about 1 hour and 30 minutes. Now, how to prepare for a Nursing Officer examination? Questions are mostly based on the 20 topics listed here, such as basic anatomy and physiology, nutrition and minerals, pediatric growth and development, microorganism, that is common disease and causative organisms, position, drug calculation, pandemic diseases or infection control, nursing procedure, that is clinical skill, general knowledge, signs and symptoms, medications and normal values, fluid and electrolyte imbalances, acid-base balance disorders, OBG, that is stages of labor, PIH, etc., psychiatric nursing, including schizophrenia, phobia, community health nursing, including PHC and RATE, emergency management, antidotes, ECG basics, and theories of nursing. Let's get started with some of the important questions, along with answers and its rationales. First question, cricoid pressure applied during intubation is to prevent bleeding, infiltration, passive aspiration of gastric contents, immobilization. And the answer will be C, passive aspiration of gastric contents. Next question is, euthanasia was first legalized in Switzerland, Netherlands, France, Italy. And the answer will be, the answer is B, Netherlands. Euthanasia, as we all know, is also called mercy killing act or practice of painlessly putting to death of persons suffering from painful and incurable disease. Next question is, select the right order of donning of PPE. Options are glove, gown, mask, eye protection, gown, glove, eye protection, mask, glove, mask, gown, eye protection, gown, mask, eye protection, and gloves. The right answer is option D, gown, mask, eye protection, gloves. Next question is, Kylo thorax is a lymphatic flow disorder, endocrine disorder, ENT disorder, none of the above. And the answer is option A, lymphatic flow disorder. Chylothorax is a rare condition in which lymphatic fluid leaks into the space between the lung and the chest wall. When this fluid builds up in the lungs, it can cause a severe cough, chest pain, and difficulty breathing. Next question is, Cushing syndrome is marked by high levels of cortisol, low levels of cortisol, high levels of thyroxine, low levels of thyroxine. Answer is option A, high levels of cortisol. Cushing syndrome is marked by high level of cortisol, whereas Addison's disease is marked by low levels of cortisol and aldosterone. In this video, you can also learn additional conditions and other possible questions which can be shooted out from the same question. Next question, how do you know that the intercostal drainage tube is functioning? Option A, continuous bubbling in the water seal drainage. B, continuous bubbling in the tube. C, oscillation of water column in drainage bottle. And D, no bubbling in the drainage bag. The right answer is option C, oscillation of water column in drainage bottle in accordance with the inspiration and expiration. Next question, tall peaked T wave is present in option A, hypokalemia, B, hyperkalemia, C, hyponatremia, D, hypernatremia. And the option is B, hyperkalemia. You can see the image here where normal ECG is differentiated from an ECG with hyperkalemia. The T wave is tall than compared with the normal ECG. Other ECG changes include flat P waves, prolonged PR interval, widened QR complexes, and tall T waves. You can also refer this topic in detail in one of our videos about ECG changes in fluid and electrolyte imbalances. For your reference, a tabular column is given about the electrolyte imbalances and the ECG changes corresponding to it. Next question is, fill in the blanks. What is the electrolyte whose level is a primary determinant of the extracellular fluid concentration? The options are A. Sodium, B. Potassium, C. Magnesium, D. Phosphate, and the answer is option A. Sodium. Sodium is both an electrolyte and a mineral. Sodium ions are the major cation in the extracellular fluid. The other functions of the sodium involves maintaining acid-base balance, water balance, muscle contraction, conduction of nerve impulses, and maintenance of blood pressure. Sodium is regulated by antidiuretic hormone, thirst, and renin-angiotensin-aldosterone system. A loss or gain of sodium is usually accompanied by a loss or gain of water. Next question is, clinical sign of hypocalcemia is A. Kernig sign, B. Chostek sign, C. Rosing sign, D. Homan sign. And the right option is B. Chostek sign. Kernig sign and Brudzinski's sign are the important manifestation of meningitis. Brudzinski's sign is one of the physically demonstrable symptoms of meningitis. Severe neck stiffness causes a patient's hip and knees to flex when the neck is flexed. Kernig sign is positive when thigh is flexed at the hip and knee at 90-degree angles, and subsequent extension in the knee is painful. Rosing sign is one of the manifestations of appendicitis. If palpation of the left lower quadrant of a person's abdomen increases the pain felt in the right lower quadrant. McBurney sign or Aron sign is also symptom of acute appendicitis. Deep tenderness is felt at McBurney's point is known as McBurney's sign. The clinical sign of referred pain in the epigastrium when pressure is applied is also known as Aron's sign. Homan sign is seen in deep vein thrombosis where pain in the calf of the leg upon dorsiflexion of the foot with the leg extended, that is diagnostic of thrombosis in the deep veins of the area. Now, Chostek sign are the short contractions of the facial muscles elicited by tapping the facial nerve below and in front of the ear, that is approximately 2 cm ventral to the earlobe. Next question is, symptoms of pregnancy-induced hypertension are A. Sudden weight loss, headache, B. Uterine contractions, headache, C. Proteinuria, headache, double vision, D. Headache, abdominal distension, and contraction. The right answer is option C, proteinuria, headache, double vision. A patient with pregnancy-induced hypertension complains of headache, double vision, and sudden weight gain. A urine specimen reveals proteinuria. Other mentioned symptoms are not associated with pregnancy-induced hypertension. Next question, when can you hear a baby's heartbeat with a fetoscope? Options are A. 8 weeks, B. 10 weeks, C. 12 weeks, D. 20 weeks. And the right answer is option D. 20 weeks. Next question is, intravenous leaking of vesicant drug into surrounding tissue is known as, options are A. Infiltration, B. Extravasation, C. Hematoma, D. Thrombophlebitis. And the answer is B. Extravasation. Infiltration is if the fluid is a non-vesicant and does not irritate the tissue. Extravasation is if the fluid is a vesicant fluid and irritates the tissue. Next question. Test used to detect the presence of COVID-19 is A. Respiratory tract polymerase chain reaction, B. Real-time reverse transcription polymerase chain reaction, C. Respiratory test polymerase chain reaction, D. Rapid test transcription polymerase chain reaction. And the right answer is option B. Real-time reverse transcription polymerase chain reaction. That is RT-PCR. Next question is, in myocardial infarction, creatine kinase increase in serum within A. 3 to 6 hours, B. 1 hour, C. 12 hours, D. 24 hours. And the right answer is option A. 3 to 6 hours. Next question. An ABG analysis report shows pH 7.26, PCO2 30 mmHg, bicarbonate 21 milliequivalent per liter. The options are A. Uncompensated respiratory acidosis, B. Fully compensated metabolic acidosis, C. Partially compensated metabolic acidosis, D. Partially compensated respiratory acidosis. And the right answer is option C. Partially compensated metabolic acidosis. If you look at the parameters, pH 7.26 is abnormal, that is acidic. PaCO2 30 is also abnormal, that is basic. Bicarbonate 21 is abnormal, that is acidic. Acid along with acid shows that it is a metabolic acidosis. PaCO2 is also abnormal, that is some kind of compensation has taken place to combat the abnormality, and hence it is a partially compensated metabolic acidosis. In partial compensation, blood pH is abnormal. Body is trying to correct the imbalance, and the secondary response is by decreasing the PaCO2. The mechanism is hyperventilation by blowing off CO2. You can refer this topic in very detail in one of our videos about ABG interpretation and compensation. Next question. Who developed the psychoanalytic theory of personality development? Options are A. Sigmund Freud, B. Maslow, C. Erikson, D. None of the above. The right answer is option A. Sigmund Freud. Psychoanalytic theory of personality development was given by Sigmund Freud. Maslow's hierarchy of needs is a motivational theory in psychology comprising of a 5-tier model of human needs. Erikson has given the theory of psychosocial development. Next question is, Freud theory of psychological development in childhood takes place during how many psychosexual stages? Options are A. 3, B. 2, C. 5, and D. 4. And the right answer is option C. 5. Freud theory of psychological development in childhood takes place during 5 psychosexual stages, and they are oral, anal, phallic, latency, and genital. The next question is, what is a normal EtCO2 reading? A. 15 mmHg, B. 25 to 35 mmHg, C. 35 to 45 mmHg, and D. 10 to 30 mmHg. And the right answer is option C. 35 to 45 mmHg. EtCO2, that is end-tidal carbon dioxide monitoring, is a non-invasive technique which measures the partial pressure of carbon dioxide at the end of an exhaled breath, which is expressed as a percentage of carbon dioxide or mmHg. The normal values are 5% to 6% carbon dioxide, which is equivalent to 35 to 45 mmHg. Capnometer device is used to measure the EtCO2. Capnography is used to detect displaced tracheal tubes and tracheostomy tubes and to diagnose inadvertent esophageal intubation. In addition, capnography has other uses in ICU relating to airway management. Next question is, the urea breath test is a rapid diagnostic procedure used to identify infection caused by A. H. influenza, B. E. coli, C. H. pylori, D. Streptococci. And the option is C. H. pylori. The urea breath test is a rapid diagnostic procedure used to identify infections by Helicobacter pylori, a spiral bacterium implicated in gastritis, gastric ulcer, and peptic ulcer disease. Next question. HbA1c test is used to estimate the hemoglobin level in the blood, glucose level in the blood, hematocrit level in the blood, BUN level in the blood. And the right answer is option B, glucose level in the blood. HbA1c is used to estimate the glucose level in the blood and to assess the condition of the patient, whether diabetic or pre-diabetic. Next question is, a patient is receiving morphine and has a bradypnea. What intervention should the nurse anticipate? Options are A, suction, B, mechanical ventilation, C, naloxone administration, and D, dopamine administration. And the right answer is option C, naloxone administration, because naloxone corrects the respiratory depression. Next question is, which drug is contraindicated when taking warfarin? Options are ferrous sulfate, acetyl salicylic acid, atenolol, chlorpromazine, and the right answer is option B, acetyl salicylic acid. ASA or aspirin can cause decreased platelet aggregation, increasing the risk for bleeding. Next question. Patient receiving electroconvulsive therapy for treatment of severe depression. Which of the following indicates that the client's ECT has been effective? A, unconscious, B, hypertension, C, grand mal seizure, D, hyperthermia. And the right answer is option C, grand mal seizure. Next question is, drug given early in symptoms of anaphylaxis is epinephrine, antacid, antiplatelet, bronchodilator. And the right answer is option A, epinephrine. Next question is, a patient has a total knee replacement and a continuous passive motion device is used to improve joint flexion, maintain muscle tone, prevent tissue breakdown, and avoid formation of a blood clot. And the right answer is option A, to improve joint flexion. Next question. Brain attack patient will be positioned initially in prone, lateral, supine, Trendelenburg. And the right answer is option B, lateral. Absence of a gag reflex is common after a brain attack. To prevent aspiration, the client is positioned on the side to allow gravity to drain mucus in the nasopharyngeal area away from the trachea. Next question. After the procedure of a subtotal thyroidectomy, nurse receives the patient in postoperative area. What will be the immediate action of the nurse? A, inspect the incision. B, instruct the client not to speak. C, place a tracheostomy set at the bedside. D, provide supine position. And the right answer is option C, place a tracheostomy set at the bedside. Postoperatively, there are chances of airway obstruction. Edema around the operative site can also cause airway obstruction, and hence it is essential to keep a tracheostomy set ready at the bedside. Next question. Which enzyme helps for the digestion of fat after emulsification? A, renin, B, amylase, C, lipase, D, trypsin. And the right answer is option C, lipase. Next question. A nurse received the serum electrolyte levels report of a patient. What electrolyte in intracellular fluid should the nurse consider most important? A, sodium, B, calcium, C, chloride, D, potassium. And the answer is option D, potassium. Potassium is both an electrolyte and mineral. It is the main ICF cation. It controls ICF osmolality and osmotic pressure and regulates cell excitability. Potassium is the major intracellular electrolyte. In fact, 98% of the body's potassium is inside the cells. Potassium influences both skeletal and cardiac muscle activity. Sodium is the most abundant cation of the extracellular compartment. Chloride is an extracellular, not intracellular anion. Other functions of potassium include maintaining acid-base balance, conducting nerve impulses, muscle contraction, controlling heart function, and controlling blood pressure. Next question. A patient is recovering from general anesthesia. In which position the patient should be placed? Options are A. Semi-Fowlers, B. Side-lying, C. High-Fowler, and D. Trendelenburg. And the answer is option B. Side-lying. Turning the client to the side promotes drainage of secretions and prevents aspiration. Next question. Doctor's order reads, administer 1 gram of injection meropenem in 100 ml of normal saline solution in 60 minutes. What is the flow rate? Drop factor is 10 drops equals 1 ml. Options are A. 33 drops per minute, B. 17 drops per minute, C. 50 drops per minute, and D. 10 drops per minute. And the answer is option B. 17 drops per minute. By using the formula, flow rate is equal to desired volume in ml multiplied by drop factor divided by time in minute gives the drops per minute. And applying all the given data into the formula, we get the answer 17 drops per minute. The next question is, the main function of underwater seal drainage of the chest tube drainage system is to check the tidalling with the inspiration and expiration, to allow air to exit from the pleural space and prevent backflow of air from entering into the pleural cavity, to know the amount of the drainage. It allows air to move freely in and out of the pleural space. And the answer is option B, to allow air to exit from the pleural space and prevent backflow of air from entering into the pleural cavity. Listed here are the principles of the chest tube drainage. For gravity, chest drain is placed below the patient's bed. Water seal allows the air from the pleural cavity and prevents backflow of the air. Suction is indicated if gravity is not enough or respiration is too weak. C. Lipase. This is all about today's video regarding the multiple choice questions of nursing officer examination preparation. If you find this video, this is all about today's video regarding the multiple choice questions of nursing officer examination preparation. If you find this video useful, please like it and please subscribe it, and do not forget to hit the bell icon to receive